Well, the U.S. has confirmed its first possible community transmission of COVID-19. The patient who lives in California has no known links to other cases or travel history to China. So that brings the total number of infections in the U.S. to 60, with most of them catching the virus outside the country.
But U.S. President Donald Trump has downplayed the likelihood of a widespread outbreak, which contradicts predictions by the country's top health experts that more infections are inevitable. All this amid criticism that the White House is not doing enough to prepare for the coronavirus threat.
Mr. Trump, though, maintains there's no need to panic.
Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads.
Vice President Mike Pence has been appointed to be in charge of the administration's efforts to combat the virus epidemic. Mr. Pence is expected to work with Congress to ensure that sufficient resources are available to keep the virus from spreading. And for more, let's speak to Nick Harper, our correspondent in Washington, D.C. Nick, any updates on that possible case of community transmission in California?
Well, Glenda, it's certainly a worrying development, this first community spread of the disease. Essentially, the CDC, the Center for Disease Control and Prevention, saying that it's come from an unknown origin. This patient hasn't traveled out the United States, and they also don't think that they've come into contact with anyone who has already tested positive for the coronavirus. So they're not exactly sure how this person could have come to have got it. We're being told that they are currently based in Sonoma County, that's northeast, just outside of San Francisco in California. They are receiving medical treatment in the Sacramento County area. But we're also told that they initially presented to hospital last Wednesday, but they weren't tested for another 4 days until Sunday, because at the time that they came into hospital, they weren't presenting with the usual type of symptoms that we have been seeing with COVID-19 patients. When they were tested on Sunday, it was found out that they did have the virus, and that's gone from there. But they've also said that those medical staff that initially came into contact with the patient have had to self-quarantine and monitor their temperatures. One interesting thing to note, though, Sonoma County, where this person originates from, is also the county where the Travis Air Force Base is located. Now, that is the location where the United States have been bringing people back to the U.S. and putting them in quarantine for 14 days. It's where a large number of the Diamond Princess passengers who left Japan and were flown back to the United States, it's where they were based. So they're looking into whether there was any potential links, any possible spread of the disease from the Travis Air Base to this person.
And Nick, mixed signals as well from the president and health officials from the Centers of Disease Control and Prevention. Has it led to any backlash on the administration?
Well, it certainly has. If President Trump was trying to reassure the public, it doesn't really seem to have worked, because once again he's come in for more criticism that he is downplaying the situation, accusations that he's being naive in his assessment, because he was very bullish and very optimistic in his tone. However, that counters what the CDC officials are saying. They're saying that we're likely to see the spread here in the United States. They say that it is inevitable. They say that disruption will be severe. That runs completely opposite to what the president has been saying. So those accusations of downplaying the situation have been coming from both the Democrats and from Republicans within his own party. The Democrat frontrunner in the presidential race, Bernie Sanders, put out a statement saying that the president was inadequate and his response was incompetent. But it's also become much more of a political issue on the funding front, because the Trump administration has put forward a plan to put together a funding package of $2.5 billion, but $1.25 billion of that was new money. The rest of it was old re-requisitioned money. And the Democrats are saying simply that is not enough. The Senate Minority Leader Chuck Schumer is saying much more is needed. And he's saying not $2.5 billion, he's saying $8.5 billion is what is needed. So there's a $6 billion gulf between what the Democrats are saying and what President Trump is saying. And one Republican even came out and said that the president was lowballing on that figure. So accusations accusations of not doing enough, not being accurate in the way that the response is being presented, but also not being accurate in the amount of funding that is being requested from the Trump administration. So they're coming in for a lot of criticism at the moment.
Many thanks for that. Nick Harper from Washington, D.C.